Your cat's behavior shifts slightly. Nothing dramatic. Nothing that screams emergency. Just small changes. A little less appetite. A little more sleeping. A slight personality shift. You think, it's probably nothing. Cats have good days and bad days. But here's what most owners don't realize. These small changes are never small. They're your cat's early warning system. They're the difference between catching a problem early and discovering it's already serious. Today on CreatureCode, we're exploring 7 subtle behavioral changes that most owners dismiss as nothing, and why ignoring them is one of the most dangerous mistakes you can make. Because understanding your cat isn't about waiting for obvious symptoms. It's about recognizing that the smallest shifts are often the loudest screams for help. Your cat's leaving food in the bowl. They're eating less than usual. You think, oh, she's just not hungry today. Cats are picky. Sometimes they don't eat as much. This is normal variation, right? But what if decreased appetite, even subtle, slight decreases, is one of the earliest warning signs of something serious happening inside your cat's body? Appetite in cats is exquisitely regulated. A healthy cat eats predictably based on their metabolism, activity, and internal state. When appetite changes, even slightly, it usually means something in their internal environment has shifted. The problem? Appetite changes are so subtle that owners miss them. Your cat still eats. They're just eating less. You dismiss it. You don't realize you're missing a critical early warning signal. Here's what's dangerous. By the time appetite loss becomes obvious, the cat is eating very little. The underlying problem has often progressed significantly. You've missed the early intervention window. A 2019 study from veterinary researchers examined appetite changes as predictors of illness in cats. They tracked 300 cats and documented appetite patterns, then followed their health outcomes over 12 months. Critical findings: subtle appetite decrease, 10 to 20% reduction, was present in 67% of cats that developed illness within the following 6 months. Cats with appetite decrease detected early, within 1 to 2 weeks, had significantly better treatment outcomes. Cats with appetite decrease that went unnoticed for 4+ weeks showed more severe disease progression. The breakthrough: appetite changes are predictive, not consequential. They appear before obvious illness symptoms. They're your early warning system. Most owners attribute appetite changes to picky eating, stress, or environmental factors. Maybe she doesn't like the food. Maybe it's warm today. Maybe she's just not hungry. They don't realize they're potentially missing the first sign that something medical is developing. Owners whose cats get early veterinary evaluation for appetite changes catch problems when they're most treatable. Establish your cat's normal eating pattern. How much do they typically eat per day? At what times? What's their typical appetite enthusiasm? Create a baseline. Then track any changes. Is your cat eating noticeably less? Are they leaving food in the bowl that they normally finish? Is their appetite timing changing? Are they showing less interest in eating? If you notice even a 10 to 15% reduction in appetite lasting more than a few days, schedule a veterinary checkup. Don't wait for obvious symptoms. Don't assume it will pass. Don't attribute it to pickiness. Investigate why the appetite changed. Early detection of appetite changes allows early intervention. Your vet can identify developing problems when they're most treatable. You've caught something early that, ignored, could have become serious. That early catch makes all the difference in outcomes. Your cat is sleeping more. Not just the normal 12 to 16 hours. More than that, maybe 18, 19 hours per day. You think, she loves to sleep. She's just a sleepy cat. But what if your cat isn't sleeping because they're content? What if they're sleeping because something is wrong and their body is shutting down in response? There's a critical difference between healthy sleep and pathological sleep. A healthy, content cat sleeps and wakes refreshed, engaged, and alert during waking hours. A cat with excessive sleep often wakes lethargic. They struggle to engage. They quickly return to sleep. Excessive sleep can indicate pain or discomfort, body shuts down to conserve energy, illness, metabolism shifting to healing mode, emotional distress, shutdown response to anxiety, cognitive decline, loss of alertness, depression, withdrawal from environment, the tragedy. By the time excessive sleep is obvious, the underlying problem has often been developing for weeks. A 2020 study examined sleep duration and quality as indicators of health in cats. Researchers tracked sleep patterns in healthy cats versus cats with developing illness. Findings: Healthy cats showed 12 to 16 hours of sleep with distinct alert periods. Cats with illness showed 18 plus hours of sleep, with reduced alertness during wake periods. Sleep pattern changes appeared 4 to 8 weeks before other obvious illness symptoms. Pain-related illness showed greatest sleep increase. Cats sleeping more to manage pain. The breakthrough. Sleep changes are predictive of illness. They appear before the cat shows obvious signs of being sick. Most owners celebrate excessive sleeping. My cat is so relaxed. She must be happy. They don't realize that pathological sleep looks like contentment but is actually a sign of shutdown. The distinction is wake time behavior. A content, well-rested cat wakes refreshed and engages actively. A cat with pathological sleep wakes lethargic and quickly returns to sleep. Track your cat's sleep-wake cycle. Document. How many hours per day is your cat sleeping? When they wake, are they alert or lethargic? How long do they stay awake? Do they engage during waking hours? If you notice your cat sleeping significantly more than their baseline, more than 18 hours daily, with lethargy during wake periods, schedule a veterinary checkup. Pay attention to quality of wakefulness. A cat who wakes and immediately returns to sleep is different from a cat who wakes and engages. The lethargy matters. Early recognition of sleep pattern changes allows veterinary investigation when intervention is most effective. You've caught something before it becomes obvious illness. That early intervention prevents progression. Your cat seems different. Not dramatically different, just off. Their personality is slightly muted. They're less playful than usual, less interested in things that normally excite them. You think, maybe she's just having an off day. But what if this subtle personality shift is your cat's way of communicating that something internal has changed? Personality in cats is relatively stable. Playful cat stays playful. An affectionate cat stays affectionate. Changes in personality, even subtle ones, usually indicate something has shifted in their physical or emotional state. A cat with pain behaves differently. A cat with cognitive changes behaves differently. A cat with emotional distress behaves differently. The changes might be small, but they're usually significant. The problem? Owners normalize these changes. She's just getting older. She's just maturing. She's just less energetic. They don't realize the personality change is a symptom, not just a personality variation. A 2021 study examined personality changes in cats as indicators of health problems. Researchers assessed cats' personality traits before and after developing various health conditions. Findings: playfulness decreased in 71% of cats before illness became obvious. Affection-seeking decreased in 58% of cats before obvious symptoms appeared. Curiosity decreased in 64% of cats in early disease stages. Personality changes often appeared 2 to 6 weeks before other symptoms. The breakthrough. Personality changes are early indicators. They are among the first things to shift when something is wrong. Most owners attribute personality changes to age, mood, or circumstance. They don't connect a subtle decrease in playfulness to developing illness. Owners who recognize personality changes as potential warning signs and seek early veterinary evaluation catch problems early. Establish your cat's baseline personality. How playful are they normally? How affectionate? How curious? How interactive? Monitor for changes. Is your cat noticeably less playful? Less interested in interaction? Less curious about their environment? More withdrawn? If you notice a clear shift from their baseline personality lasting more than a few days, note it. If multiple personality traits shift simultaneously, this is especially worth investigating. Schedule a vet visit if you notice significant personality changes. Don't wait for obvious symptoms. The personality change is the symptom you should act on. Early recognition of personality changes allows early veterinary investigation. You're not diagnosing anything. You're simply bringing your vet's attention to the shift and allowing them to investigate. Early investigation often reveals early-stage problems when they're most treatable. Your cat's grooming habits are changing. Either they're grooming less, their coat looks less shiny, a bit matted, or they're grooming more obsessively in one area. Either way, something about their grooming has shifted. You think maybe it's just a phase. Maybe her coat's different. Maybe she's just stressed. But what if grooming changes are telling you something important about their physical or emotional state? Grooming is a high-priority behavior for cats. A healthy cat maintains their coat meticulously. Grooming is how they regulate temperature, manage stress, and maintain hygiene. When grooming habits change, it usually means either pain or discomfort, making grooming difficult, illness, causing disinterest in grooming, emotional distress, expressing as over or undergrooming, cognitive changes, loss of grooming priority. The problem: grooming changes are subtle. The coat gets slightly less shiny. A small mat develops. An area shows slight overgrooming. These are easy to miss or dismiss. A 2019 study examined grooming behavior changes as indicators of health and emotional status in cats. Researchers documented grooming patterns in healthy cats versus cats with various conditions. Findings: cats with pain showed 40% decrease in grooming behavior. Cats with systemic illness showed decreased coat condition. Cats with emotional distress showed either decreased or obsessive grooming. Grooming changes often appeared weeks before other obvious symptoms. The breakthrough: grooming behavior reflects overall health status. Changes in grooming are worth investigating. Most owners dismiss grooming changes. They assume the cat will maintain their coat or that grooming variation is normal. Owners who notice grooming changes and investigate find that addressing underlying causes often improves coat condition naturally. Monitor your cat's grooming habits. Is your cat grooming less frequently? Is their coat less shiny or lustrous? Are mats developing? Is there area-specific overgrooming? Are there bald patches or skin irritation? Establish baseline grooming. A healthy cat's coat should be shiny and mat-free. Changes from this baseline worth investigating. If you notice grooming changes lasting more than a few days, schedule a veterinary checkup, rule out pain or medical issues, assess emotional state, any recent stress or changes. Monitor for additional symptoms. Don't assume grooming changes will resolve on their own. They often indicate something worth addressing. Early attention to grooming changes allows early identification of underlying problems. You might discover manageable issues early, preventing them from becoming serious. The simple act of noticing and investigating can prevent larger problems. Your cat's litter box usage is slightly different. Maybe they're going more frequently. Maybe they're using the box differently. Maybe the urine or stool consistency seems slightly off. You think, it's probably fine. Bathroom habits vary. But what if subtle litter box changes are one of the earliest signs that something medical is developing? Litter box habits are remarkably consistent in healthy cats. When habits change, frequency, urgency, consistency, it usually indicates something has shifted in their urinary or digestive system. A 2020 study examined litter box usage patterns as early indicators of urinary and digestive disease in cats. Researchers tracked litter box behavior in hundreds of cats and correlated it with health outcomes. Findings: increased urinary frequency appeared 4 to 6 weeks before obvious urinary disease symptoms. Litter box avoidance appeared weeks before pain-related conditions were diagnosed. Changes in urine or stool consistency often preceded illness by 2 to 4 weeks. The breakthrough: litter box changes are predictive. They appear before the cat shows obvious illness symptoms. Most owners don't monitor litter box habits closely. They know their cat uses it, but they don't track frequency or consistency changes. Owners who pay close attention to litter box habits catch changes early and allow for early veterinary investigation. Establish baseline litter box habits. How many times per day does your cat urinate? How often do they defecate? What's the normal urine volume? What's the normal stool consistency? Monitor for changes. Increased frequency of urination or defecation. Changes in urgency or straining. Different urine color or smell. Stool consistency changes. Box avoidance or unusual positioning. If you notice changes, note the specifics: frequency, timing, consistency. Schedule a veterinary checkup, especially for urinary changes, which can be serious. Don't wait for obvious symptoms. Litter box changes deserve prompt veterinary attention because some urinary issues can be serious. Early detection of litter box changes allows early intervention for potentially serious conditions. You've caught something before it becomes an emergency. Early intervention prevents complications and allows for better treatment outcomes. Your cat's meowing sounds different. Maybe quieter. Maybe more frequent. Maybe the quality has changed. It sounds slightly different from their normal meow. You think, oh, she's just being vocal today. That's fine. But what if changes in your cat's vocalization patterns are telling you something important about their physical or emotional state? Your cat's voice is consistent. They have a recognizable meow. Changes to that meow pitch, frequency, urgency, quality usually indicate something has shifted. Vocalization changes can indicate pain, causing vocal changes, thyroid issues, affecting voice, emotional distress, changing vocal patterns, cognitive changes, altering vocalization, urinary issues, causing increased vocalization. The problem? These changes are subtle. The cat is still meowing, just slightly differently. You might not register it as a change unless you're paying attention. A 2021 study examined vocalization patterns in cats with health conditions. Researchers recorded and analyzed meows from healthy cats and cats with various medical and behavioral conditions. Findings: pain-altered meow characteristics, pitch, duration, thyroid disease changed vocal patterns, distinctly urinary issues caused increased vocalization, emotional distress altered meow quality. The breakthrough: vocalization changes reflect internal state changes. Noticing these changes allows for early investigation. Most owners don't track vocalization patterns carefully. They hear their cat meowing but don't register subtle changes in quality or pattern. Owners who notice vocalization changes and investigate can catch underlying issues early. Establish baseline vocalization. What does your cat's normal meow sound like? How frequently do they vocalize? What situations trigger vocalization? Is there a characteristic pitch or quality? Monitor for changes. Is the meow sounding different? Higher or lower pitched? More or less frequent? Different urgency or quality? Vocalization in new situations? If you notice changes, note the specifics: pitch, frequency, situation. Consider context. Is there a clear trigger? Schedule a vet visit if changes persist. Vocalization changes, especially if accompanied by other symptoms, warrant veterinary evaluation. Attention to vocalization changes allows you to catch subtle problems early. You're not diagnosing anything. You're simply noticing changes and bringing them to your vet's attention. Early attention often reveals early-stage problems before they become serious. Your cat's hanging out in different places. They used to always be in the living room. Now they're hiding in the bedroom. Or they're positioning themselves differently. Maybe they're seeking warmth more. Maybe they're avoiding certain areas. You think, she's just exploring different spots. That's fine. But what if these location and positioning changes are telling you that your cat is uncomfortable or that something internal has shifted? Cats are creatures of habit. They have preferred spots. They have routines. When these change, especially when the change is toward hiding or unusual positioning, it usually means something has shifted. Location changes can indicate pain, seeking heat or seeking isolation, anxiety, hiding more, seeking safety, cognitive changes, disorientation, illness, seeking comfort positions, environmental stress, seeking escape. The problem: these changes are subtle. Your cat still moves around the house. They're just moving to different places. You might not notice unless you're paying attention. A 2022 study examined spatial behavior and location choices in cats with health conditions. Researchers tracked where cats spent time and in what positions, comparing healthy cats to cats with various conditions. Findings: cats with pain showed 40% increase in heat-seeking behavior. Cats with anxiety showed 60% increase in hiding behavior. Cats with illness showed positioning changes. Hunched postures, unusual positions. These behavior changes often preceded obvious illness symptoms by 2 to 4 weeks. The breakthrough: location and positioning choices reflect internal state. Changes in these patterns are worth investigating. Most owners don't track their cat's location patterns carefully. They see their cat moving around and assume everything is fine. Owners who notice location changes and investigate can catch underlying issues early. Establish baseline location patterns. Where does your cat typically spend time? What are their favorite spots? Do they prefer warm or cool areas? Are there consistent patterns to their movement? Attention to location and positioning changes allows early detection of comfort issues or health problems. You've noticed something before it becomes an obvious problem. Early attention often allows for early intervention that prevents complications. If these 7 small changes are finally making sense to you, if you're realizing how much information your cat communicates through subtle shifts, hit like and subscribe so we can share this with every owner who wants to catch problems before they become serious. On CreatureCode, we decode the subtle language your cat uses to communicate that something has changed, because understanding your cat isn't about waiting for obvious symptoms. It's about recognizing that the smallest changes are often the loudest screams for help. Your cat is constantly communicating through these subtle shifts. Appetite changes, sleep pattern changes, personality shifts, grooming changes, litter box changes, vocalization changes, location and behavior changes. None of these changes are small. All of them deserve attention. None of them should be ignored. The difference between catching a health problem early and discovering it's already serious often comes down to whether you noticed these small changes and acted on them. Start today. Establish baselines for all 7 areas. Pay attention to your cat. Notice when something changes. Don't dismiss it. Investigate. Call your vet. Your cat is counting on you to notice. And the smallest changes are often the most important ones. Thanks for watching. And go check on your cat right now. Is anything different from their baseline?